Hello, this is Alicia Sam, and you're watching HWNews. On July 23rd, the World Health Organization (WHO) declared monkeypox a public health emergency of international concern, considering global outbreaks in all six regions in multiple countries. Reports related to monkeypox suggest that monkeypox in India is driven underground by anti-gay stigma. Now, as India's monkeypox cases count rose to 9 this week, with Kerala reporting its fifth case, patients are reluctant to seek testing or treatment for a disease that has recently afflicted gay and bisexual men. How true this is, let us know from Dr. Ishwar Gilada, the first person to raise the alarm against AIDS in India 1985 and to start India's first AIDS clinic 1986. At the government-run JJ Hospital, Mumbai, Dr. Ishwar Gilada is globally acclaimed HIV expert credited with bringing India and the AIDS control map on the world. Also, an acclaimed infectious disease expert. Welcome to the show, Dr. Gilada. So, Doctor, in India, a total of 9 monkeypox cases have been reported so far. Now, that being said, India's population is 138 crore, and that the reported cases seems a little too less compared to the population we have in India. Is it because that the cases, monkeypox cases, are going unchecked in India? Is that the reason the cases are low in India? The monkeypox cases.
You see, the possibility that monkeypox has come little later than other countries, started mainly in Europe, which is out of endemic countries. Endemic countries means countries of Africa where it was prevalent for many years. And out of endemic countries, only it started 2.5 months back, almost 3 months back. In that comparison, India, it had come little late. But basically, this disease has got triple stigma. The first stigma is with the name monkeypox. The moment you say monkeypox, that means something which is related to monkeys. And any doctor would ask a patient, "Have you done any monkey tricks to get monkeypox?" So patients will not come forward. That is number one. Number two, mainly it is sexually transmitted. And in a country like India, which is a culturally different country than many other European countries or African countries, there's a stigma attached to sex, and particularly sex outside marriage. The third stigma is related to sexuality of a person, because mainly it is seen male having sex with male. And though it was initially illegal in the country, Section 377 was repealed. Thereafter, it became legal. But despite that, there is a lot of stigma attached to that. People do not come out of closet. People do not come out so easily. And with this triple stigma, people will not come forward to be tested. Now, secondly, what has happened? You see in Kerala, one fellow died of this monkeypox. What was the statement next day? That by now we know the route map of the person, how he traveled. And everybody who has come in contact with that person is quarantined. That includes 14 airline passengers, taxi driver, bus driver, his family members, doctors and healthcare workers. Now you tell me, I'm a doctor and my healthcare establishment, about 12 people are working with me. If a suspected or diagnosed monkeypox case comes to me, and tomorrow my state government says that all of you are quarantined because you treated a monkeypox case or you diagnosed a monkeypox case, will I come forward? So doctors, healthcare establishment, patients themselves, they will all go underground. And therefore, what I have been telling since beginning, even before the monkeypox came in the country, that we should have a mechanism in our country in place by which people will not go underground. They will come forward. Secondly, if you suspect that there could be stigma and discrimination, you make a law in the beginning itself that anybody who violates the person's identity, stigmatize the person, violate their human right conditions, then that person will be charged. So once you have a anti-discrimination law in place, I think people will be very much sane and they will not behave the way they are behaving now, like this now. What you have seen that after the Kerala case, the high-powered medical team goes from Delhi to Kerala. You tell me what they are going to do there. Are they going to treat the case? You don't need such high power. You don't have to hound on patient or patient families on a state where the cases are there or an establishment. If such kind of thing will happen, the people will not come forward. And lastly, the testing facilities are very few. Only NIV Pune, National Institute of Virology Pune, and probably Kerala has started one facility. So we need to expand the testing facilities so that test can be done in every state.
Right, doctor. What is the vital reason for monkeypox cases being unchecked in India? Since there are reports that say that monkeypox cases are stigmatized as anti-gay disease. What is the reason about it?
No, no, because once any disease which is sexually transmitted, and particularly in male sex with male, and male sex with male, they don't usually come forward so easily. But the way the cases are publicized, the way, though you may not be publishing the name because of some code of conduct or ethics, but you are publishing everything. So, as Mr. X or Mr. Y, if that Y's relatives are quarantined, the community where the person lives, you know that everybody knows that Mr. Y is here. If the doctor or a healthcare establishment is quarantined, or in an auto rickshaw where he travel, or a bus driver, or a taxi driver, or his own driver is quarantined, that means everybody will come to know that this person is monkeypox positive. So people will not come forward so easily. They will go unchecked. They will go underground. Secondly, what you are doing is a wrong kind of contact tracing. Contact tracing is required, is very important tool in public health. But what kind of contact tracing is required? For example, a Delhi person who picked up the monkeypox did not travel abroad, but he traveled to Himachal Pradesh. So what you need to do is you need to take that person into confidence with whom he had sex, whether the person was from Himachal Pradesh or from some other state where they met in Himachal Pradesh, and with confidence go to that person and talk to that person. Now, this kind of mechanism can be done only by those which are experienced in dealing with proper history taking and proper contact tracing. I suggested that because National AIDS Control Organization or NACO, mind well, I am not employed with NACO, I have no relations with NACO. I'm just suggesting because we have an experience of NACO's dealing, they are running the AIDS control program fairly well. Now, if you involve NACO, what will happen? NACO has 2000 plus ICTC center, that is Integrated Counseling and Testing Center. They have 1050 ART center where people go for taking ART for HIV. So they have 3000 plus centers. They have partnership program with the gay community. They have partnership program with the Hijra community. They have partnership program with the LGBT community. They have partnership program with the sex workers. So your target population where monkeypox is likely to be more seen, they are under umbrella or ambit of NACO. The program can be cohesive. There can be targeted approach. You are not doing that. We are creating a scare in society in such a way that every person in the society is at risk of getting monkeypox. You are saying it is a respiratory tract transmitted infection. It can be transmitted through droplet. It can be transmitted through touch. So a person traveling in Mumbai local or a bus will always think that I can pick up monkeypox here, which is not so. Globally, whatever cases are there, show me one single case where the person got from something else than sex. If globally not a single case is transmitted something else than sex, how can you create such kind of scare? Just because COVID is going on and everything coming, you are equating with COVID. COVID is transmitted through droplet. It doesn't mean that monkeypox is transmitted through droplets. Medical science has two very good principles. Principle number one is common things are thought of commonly, rare things are thought of rarely. What is common in monkeypox is sexual transmission. What is more common? Male to male transmission. So those things will remain common. Rare thing, yes, it is possible that accidentally it can be transmitted through towels or bed sheets or household contact or skin to skin contact. So the second principle of medicine applies here, that the chances may be least, you take precautions the most. So even though the chances may be 0.1%, 0.001%, but medical professional will take precaution. Therefore, asking medical professional dealing with monkeypox to wear mask or gloves is fine. But asking everybody, Tom, Dick and Harry, that you use mask, it is not going to protect you from monkeypox, nor it is transmitted through that way. So we should categorically decide whether it is a STI or whether it is a droplet infection. If it is a droplet infection, whole country, whole world is a target. If it is a STI, only sexually active people are target. In that also, those which are already vaccinated against smallpox, and vaccination stop around 1980 or 1979, they are already protected. Almost 85% of them are protected, and those who will get, they will get a mild infection. So your target becomes people who are below 42 or 43 years of age, sexually active people, people having multiple sexual contacts, male sex with male, bisexual, or heterosexuals are having multiple sexual contacts. So your target becomes less. So you can work very closely. That is not that.
Right. Okay, doctor. Now, like you said, although India has Section 377 repealed, India is still dealing with accepting homosexuality and the stigma related to all of it. Where homophobia and life-threatening discrimination is arrived, what measures should be taken to spread awareness regarding monkeypox, since it is sexually transmitted, which is common in it? What awareness should we take?
Basically, all kind of stigma and discrimination related to sexuality in India will not go away in this generation, maybe another two generations. We have a double standard of social mores. We have like a carpet culture. Above the carpet, very clean, below the carpet, fine dust. We have known that homosexuality existed in India for maybe 2000 or 5000 years. We have seen the carvings, paintings of ancient places, which are heritage sites. We have a Hijra cult going on 20 for at least 2000 years. So Hijra cult itself is a male sex with male. So we had all these things existing as a social norm, but at the same time we made them legally illegal. At the same time, we don't want to see them happening. I don't want to see them near my vicinity. So with this double standard, the stigma associated with sex will not go away so easily. But we need to keep on doing our efforts. We have seen, at least in my life, I have seen that the stigma and discrimination is lesser and lesser and lesser what it was 10 years back or 20 years back or 30 years back. I started working with Hijra community doing my postgraduate dissertation in 1980 to 83. That time nobody would accept them in anywhere. Now you go to international conferences. I was just recently there in Montreal for International AIDS Conference. There are so many Hijras from all over the world gathered there. So that discrimination has come down. They are being accepted. They are coming at center stage. Same thing with MSM community. There are organizations like Humsafar Trust, Nas Foundation, etc. There were hardly few people, minuscule few 30, 40 years back. Now they are large communities. So acceptance is coming, stigma is getting reduced, and once they gather, they themselves become a group. They have a peer group model where they can deal with their own issues properly. There is a saying, "घायल की गति घायल जाने और न जाने कोई." So घायल means those which are already betrayed, they understand the suffering of other betrayed. Other people don't understand.
Okay, so doctor, like COVID-19, there is no rapid process of creating awareness or detection of the detection in the context of monkeypox, where infections are currently occurring most via sexual networks. Identifying the contacts is a sensitive issue. What's your take?
So that's what I've been saying, that if you identify a case or you suspect a case, you first analyze. There are three things which are required for coming to a proper diagnosis. Number one, history of the person. Number two, examination finding. And number three, test. It is not merely the test, it is not merely the suspect, it is also history. Take proper history. If the history is contributory, then lead to further what symptoms are there. Some symptoms are atypical as compared to the previous monkeypox, which was seen in endemic countries in Africa. So currently, earlier we have never read anywhere that is a perianal pox marks. Now the anal region there are pox marks. We have not seen much of genital pox marks. We have seen only on face, hands, or feet, or trunk, or back. So the atypical symptoms are there. So you see that, then you do the test, and test can be PCR, and there is a PCR test which is done initially on the pox variety group. So it will show either pox variety is positive or not. If it is positive, then you do a specific test for monkeypox, because there are 10 to 11 other infections that can occur in pox variety family. One of them is molluscum. One of them is molluscum contagion is very common. Smallpox, which is not so common, but cowpox, squirrel pox, horse pox, Alaska pox. There is a lot of pox variety family diseases, and then they are managed expert with the expert, and you can have some antivirals which are like tecovirimat, brimcidofovir, and even a smallpox vaccine can be used for treatment of monkeypox cases. So smallpox vaccine is dually effective. One is to prevent monkeypox, so vaccine can be used for prevention, and one is for treatment, for is called therapeutic vaccine. Again, that will be useful. So that I have been telling of my country that you start manufacturing or restart manufacturing smallpox vaccine. Not only for India, it will be good for the entire world. Currently, the vaccine is in short supply. There are only two vaccine companies, and both are owned by US. So US will decide which country should buy, and all rich countries we have seen in COVID, they will first take their own supply in their hand. Nothing will be left for the global south. So for global south, India is the only ray of hope. Therefore, India should, being a vaccine powerhouse of the world, being a pharma powerhouse of the world, should start manufacturing smallpox vaccine as early as possible, and side by side do R&D to make a specific monkeypox vaccine. Currently, is a smallpox vaccine, therefore protection is around 85%. If you make a specific monkeypox vaccine, protection may be around 100%.
They say, like in India, people say that monkeypox is a gay disease. How true is this? And since you said that it is commonly found in men, bisexuals, is it a gay disease? Like,
You see,
uh,
we should also go by the history. History of the diseases, particularly you talk about HIV. HIV
right,
started in gays. It was six initial cases were diagnosed in California, and it was called a gay plague in 1981. And at that time, all six were white, all six were gays, all six had a similar disease which was called PCP pneumonia and Kaposi sarcoma, a type of a cancer. But thereafter, it spread from them to bisexual to heterosexual. And today, what we see globally, almost 90% cases are in heterosexual community, 1 to 2% from mother to child transmission, another 1 to 2% from blood transfusion, and remaining 7 to 8% are all homosexual transmission. So, though it started with the MSM, it ended up as a heterosexual disease. So, basically, call it STD, don't call it homosexually transmitted disease. It is transmitted sexually, it is a sexually transmitted disease. Whether it is MSM, whether it is bisexual, whether it is heterosexual, those who are having multiple sexual partners, those who are having unsafe sex, those who are having sex outside their ambit of a one-to-one relationship or marriage, they are at risk. And therefore, it's wrong to label it as a gay pox disease or a gay monkeypox. It's gay related thing. It is sexually transmitted.
okay. So, doctor, do we need to have mental guidance for the people who are infected with monkeypox, getting themselves detected, as our Indian society is still stigmatizing monkeypox because, like I said, they call it gay disease. So, how important should mental preparation be for the people who want to come out and tell, I have been detected with monkeypox, or just to tell them we have those symptoms?
I think the first and foremost is respecting their own decision. Don't force them to do anything. Don't use law, environment machinery, law and enforcement machinery. And that's the reason that once they feel that they are confident with you, they will deal with you. They will want to have teleconsultation, personal consultation, consultation at their home. That is fine. But if you try to force them, you try to use a legal machinery against them, they will go underground. Other people will go underground. Their families will be stigmatized. So they are all scared of that. And precisely that is the reason, despite I had two of my patients much before the cases were declared in India. But because my patient didn't want to come to foray, they said that I don't want to be first monkeypox case in India. I had to respect that decision of the patient. And till today, I continue to respect. The things will never let out to public that such and such person is my patient. Never.
Right. So yeah, that's all for the question and answer session. Thank you so much, doctor, for your so much time. We really respect, and thank you for enlightening our viewers with the same. See you again.
Thank you.
Thank you, doctor.